Citrate of magnesia is used to clean stool from the intestines before surgery or certain bowel procedures, such as colonoscopy or radiography. It can also be used to provide relief from constipation. However, for milder constipation, it is recommended to use other products like stool softeners or bulk-forming laxatives whenever possible. Citrate of magnesia is a saline laxative that works by increasing fluid in the small intestine, typically resulting in a bowel movement within 30 minutes to 3 hours. When using citrate of magnesia, always follow the directions on the product package. If you are using it before surgery or a bowel procedure, your doctor will let you know when to take it. If you have any questions, ask your doctor or pharmacist. The dosage of citrate of magnesia is based on your medical condition, age, and how you respond to the treatment. After taking this product, be sure to drink a full glass of water unless directed otherwise by your doctor. This will help prevent serious side effects such as dehydration. Using this product too often may cause a loss of normal bowel function, leading to a dependence on laxatives. If you notice symptoms of overuse, such as diarrhea, abdominal pain, decreased weight, or weakness, contact your doctor right away. It's important to avoid taking tetracycline/quinolone antibiotics, such as doxycycline, tetracycline, ciprofloxacin, within 2 hours before or after using citrate of magnesia, as it may decrease the effect of the antibiotic. If citrate of magnesia does not produce a bowel movement, or if you think you may have a serious medical problem, contact your doctor promptly. Remember not to freeze this product, and for a better taste, it can be chilled in the refrigerator before use. If you experience mild abdominal discomfort, cramps, gas, or nausea while taking citrate of magnesia, it's important to let your doctor or pharmacist know. However, many people using this medication do not experience serious side effects. It's important to tell your doctor right away if you have diarrhea that doesn't stop, severe stomach or abdominal pain, slow or irregular heartbeat, mental or mood changes, muscle weakness, bloody stools, or rectal bleeding. If you notice symptoms of dehydration such as decreased urination, dry mouth, increased thirst, lack of tears, dizziness, or pale skin, it's important to contact your doctor promptly. While a serious allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you have any concerns or questions about the side effects of citrate of magnesia, don't hesitate to reach out to your healthcare provider for advice. Before using citrate of magnesia, it is important to talk to your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions or other problems. It's best to consult with your pharmacist for more details before use. It's also important to discuss your medical history with your doctor or pharmacist before using this medication. This includes any history of rectal bleeding, bowel problems, heart disease, kidney disease, or current stomach/abdominal symptoms. If you have experienced a sudden change in bowel habits lasting more than 2 weeks, or if you need to use a laxative for more than 1 week, it's important to consult your doctor before using this product. For children younger than 2 years, there may be a greater risk for dehydration while using this drug, so it's crucial to be cautious. If you are pregnant, it is essential to use this medication only when clearly needed and to discuss the risks and benefits with your doctor. For nursing mothers, it's important to consult with your doctor before breastfeeding while using this medication. When taking citrate of magnesia, it's important to be aware of potential interactions with other medications. It's always a good idea to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with citrate of magnesia include digoxin, sodium polystyrene sulfonate, and tetracycline/quinolone antibiotics such as tetracycline and ciprofloxacin. Be sure to discuss any potential interactions with your healthcare provider. As always, it's important to follow their guidance when taking this medication. If someone takes too much citrate of magnesia and starts to have severe symptoms like passing out or difficulty breathing, it's important to call 911 for emergency help. Otherwise, you can call your local poison control center right away. In the US, you can reach them at 1-800-222-1222. If you're in Canada, you can call a provincial poison control center. Signs of an overdose may include muscle weakness, a slow or irregular heartbeat, and changes in mental or mood-like confusion. When taking citrate of magnesia, it's important to follow the recommended dosage on the label. This medication is typically used to relieve constipation or to prepare the bowel for medical procedures. It is usually taken on an empty stomach at bedtime or as directed by your doctor. Remember to drink plenty of water while using this medication and do not use it for more than 1 week unless directed by your doctor. Always consult with your healthcare provider to determine the best treatment for your individual needs. Make sure to keep all your medical and lab appointments. In order to maintain regular bowel habits, it's important to drink plenty of fluids, such as 4 to 6 8-ounce glasses daily, eat foods high in fiber, and exercise regularly. Citrate of magnesia is used to treat occasional constipation and to clean the bowel before certain medical procedures. It may also be used for relief of upset stomach and heartburn. This product is meant to be used as a laxative. Dosage is based on your medical condition, age, and response to treatment. For best results, take this product with a full glass of water, 8 ounces or 240 milliliters, as directed by your doctor. It is best to take this medication on an empty stomach at least 1 hour before or 2 hours after a meal. When it comes to storing citrate of magnesia, it's important to follow the instructions on the package label. If you have any doubts about storage, you can always ask your pharmacist for advice. Avoid freezing the medication and don't store it in the bathroom. Keep all medications out of reach of children and pets. When it comes to disposal, do not flush citrate of magnesia down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to dispose of it. In terms of usage, citrate of magnesia is commonly used as a laxative to relieve occasional constipation. It works by drawing water into the intestines, which helps to soften the stool and make it easier to pass. The typical adult dosage for constipation relief is 240 milliliters taken orally once a day, usually in the morning. It's important to follow the dosage instructions provided by your healthcare provider or as directed on the product label. It's best to take citrate of magnesia on an empty stomach, at least 1 hour before or 2 hours after a meal. Be sure to drink plenty of water while using this medication to help it work effectively. If you have any concerns about using citrate of magnesia, such as the right dosage or timing, it's always a good idea to consult a healthcare professional for personalized advice. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.